Hello and welcome to this special show on Rajya Sabha television where we bring you all aspects of India's fight against COVID-19, be it the technological interventions or the developments which are happening on the front of drugs being developed or the vaccine being developed and other aspects as well. So today we are going to talk about a very interesting and a very important aspect as far as COVID-19 is concerned. That is the correlation between coronavirus, that is COVID-19, and rising temperatures or rising humidity, because the summer is setting in slowly in India, and how this virus might behave in the coming days, weeks, or months as far as the hot temperature is concerned. There have been some studies which have been conducted by CSIR Institute NEERI, and there are other projects which are going on as well. We have a distinguished panel with us today. Let me first introduce the guest to you, beginning with Dr. Rakesh Kumar. He's the director of CSIR's Institute, that is National Environmental Engineering Research Institute, NEERI. We also have with us Ms. Soumya Lipsa Rath. She is the assistant professor from Department of Biotechnology at NIT Warangal, and she's part of a team which is working on a particular project on this aspect only, that is the relation between COVID-19 and the rising temperatures. We're also joined by Dr. Pranab Chatterjee, scientist with ICMR. Thank you so much, all of you, for being here on Rajya Sabha television. And let me begin with you, Dr. Rakesh, because your institute has recently conducted a study based on data from the meteorological department, as well as the other data of how the infections have spread and how they have gone up or gone down in certain areas. So what does your study say? That is one. And two, what were all the parameters which you guys worked on?
Right. So basically, I would first want to clarify that the study was not done through a medical point of view. The whole idea of understanding this whole spread was based on the meteorological conditions, and there was a lot of speculation and media reports, as well as so-called some scientific report as well, that temperature and humidity plays a role into this. So what we did, we looked at temperature profile of city like New York, Srinagar in our country, Kasargod in India, Mumbai, and one or two more cities. And we looked at all of these profile over a period of time, and then we tried to look at mathematically what does it show. And it was very clearly showing that the rising temperature and humidity combination does show a correlation of fall in numbers. Now, and on that basis, we used a model, and we got some numbers. But what is important here, which came out of the study, is that while we will see all of these decline, unless until we have that social distancing in place, because when we have a lockdown situation, people are not outdoors; they are mostly indoors. And in indoors, if your social distancing is not being maintained, it's not going to give you that benefit. And
Okay.
overall promise, if you see, of the temperature that is rising in our country, is definitely going to reduce our exposure from outdoor surfaces of COVID-19 infections. That's what positively comes in. But the moment when you come in situation of slums, and you are mixing to when you go buying vegetables or any purchases, these are not going to benefit much. So that was overall, I would say, objective and conclusion of the study.
Okay, so what you're saying, Dr. Rakesh, if I understood it better, and for the benefit of our viewers as well, that there seems to be a correlation between the rising temperatures and the decline in numbers of infections, but the constant here is social distancing norms. The crowding or the overcrowding will have to be taken care of on the outside surfaces, because the temperature would be high. There might be some relief in terms of the virus not sustaining itself, but social distancing norms remain the key. Is that what you're saying?
Absolutely, that's true. So just for information again for viewers, so when we have outside temperature in the range of about say 33, 35, but surfaces on which the sun is shining, that the temperature could be much higher. So if it's a road surface, the temperature could be 40, 45. Even when your ambient temperature is 35, 30, 33, 35. On glasses, it could be even higher. On steel, it could be much higher. So some of these surfaces in outdoors are going to be extremely heated, and the likelihood of their survival on those surfaces are going to be minimum. And therefore, anyone touching those surfaces are not likely to get infected. So that's the benefit that a country like India or similar countries or similar cities will get. But the
Mm-hmm.
moment you come indoors, you are still in the temperature range which is comfortable, and you are staying close by. So if you are staying with an infected person, then you are likely to get the
Okay.
problem. Yes.
Okay, one more question here before I move on to Ms. Rath and Dr. Pranab here is that some experts have also pointed out in their studies of cases, like countries like Singapore or Ecuador, where the temperatures are high, but the numbers of infection, that is the COVID infection, also increases. So there seems to be some anomaly out there with respect to these two parameters which you're talking about, or that, or is there something else which we are not taking into consideration?
You want me to answer
Yes,
this?
yes, yes, Dr. Rakesh,
Yeah.
yes.
Okay. So it's like this. When you see the temperature profile of say three places in India alone, Mumbai is a coastal city, and that temperature right now in 33, 35 ranges. If you see Chennai is similar ranges, and then you take Kerala, any of the cities which are in coastal region, they also have the similar humidity and temperature. But the numbers of cases which are rising or not, which are not getting reported, clearly shows you that Kerala has much more social distancing which is taking place and has taken place. Chennai is second, and then is Mumbai. So when you have 50-60% of population staying in slums where the distance is almost not there, I would say. So obviously we see those cases, and the pockets within city. If you see Dharavi or some of the Jijamata Nagar and some such places, densities are unimaginable. So in a place like 10 by 10 room, almost 6 to 8 people are staying, right? And you can't get outdoors when
Okay.
the lockdown situation is there. So number of cases actually also correlate. We are looking at the next step of analysis with the new set of data. Whatever data that we used till date was up to 3rd of April.
Mm-hmm.
We haven't looked at whole of April right now, and
Okay.
we will. Prima facie, it looks like this is the way the situation arises, and this is the way probably model will also predict.
Okay. So perhaps when you look at the April data, there might be some more, permutation and combinations or probabilities which the numbers or the data might throw up. Mr. Rath, I'd like to bring you in here, and you're working with a global consortium on a particular project of the similar nature that is try and find out what's the correlation between this particular virus and hot or humid temperatures. So, what are your parameters which you and your team is working on, and any particular findings so far?
Yeah, so actually I'm doing a theoretical study on the virus proteins. So it is based on the statistics which is already available. Like I have, like this proposal was based on the earlier articles. So earlier statistics with the SARS and MERS virus which had come earlier.
Mm-hmm.
So there are many data on the number of cases which vary from one region to another, like one country to another. Like even today, if you see the number of cases in North America and South America, there is difference. And this difference, there is some role of temperature. They have said there is a role of temperature. Now, again, there is a question that MERS virus, it was there during the April to August time. So that is a temperature, that's a peak, right? So there is also a role of humidity. So both are essential. So what I'll be studying is I'll be studying the structure of the virus. Like
Mm-hmm.
I'll be simulating it in an artificial environment, like in a computer. I'll be using molecular dynamics simulation, and I'll try to see how the virus protein is actually changing in how is it responding at different temperatures or different humidity condition. So I have begun my work, and I am hopeful that some changes might happen because proteins generally they respond to different temperatures.
Mm-hmm.
So when we are talking about social distancing, as Professor Rakesh told, social distancing we are doing to avoid the transmission between two individuals, whereas the virus is there in the air also. So that rate of transmission in the air, like that also reduces when the humidity or the temperature conditions are different.
Mm-hmm.
So here I'm not taking any other thing, only the virus, and I'll be studying how it is, like what kind of changes are happening in its structure when the like conditions are different.
Okay. Okay, let me bring in Dr. Pranab Chatterjee here. Dr. Chatterjee, from your point of view, what we seem to understand is that obviously a virus is made of proteins and molecules. Temperatures will have an effect. Either the rising temperature or the lower temperatures and high humidity as well. But the correlation as to how it behaves, that is really, really important for us. From your point of view, what is that correlation? Does it have any effect, the rising temperatures and high humidity, does it have any effect on COVID-19 infections?
Okay, thank you. That's a very interesting question. First off, I would like to state that correlation does not indicate causation. So even if there is a correlation, it does not imply that because of the reduction or increase in temperature, we're going to see a reduction in the number of cases.
Okay.
It's just a correlation at this point. The second thing that I want to stress is that this is directly building off of our knowledge and experience with respect to seasonal influenza and its transmission patterns. However, we need to remember that influenza is almost like an annual visitor that comes in and around and circulates every year. Comparing the dynamics of a very new, novel, emergent virus, which has new antigenic properties with an immunologically naive population which is getting exposed, might not be the best way to compare. The third thing is that with MERS, there was no indication of seasonal transmission. With SARS, it was the massive public health effort that managed to shut it down. However, when Toronto in Canada opened their public health systems early, when they had a second peak of SARS. So my feeling is that there might be reductions in the burden of COVID-19 as the temperatures and humidity rises, but we should not depend upon it as public health doctors or public health policymakers. We should not depend upon the rising temperatures and humidity to control the disease for us. As Dr. Rakesh and Ms. Rath have implied, we have to ensure the proper public health interventions. Social distancing is in place, and hygiene is maintained across all sectors to ensure that the transmission is cut down. And as far as surface-related transmission is concerned, we must be wary of high-touch surfaces. And these high-touch surfaces means these are the surfaces where the infected people or the infected droplets or transmissible droplets come in higher contact with. And these are usually situated indoors. So even if the outdoor temperature raises up to 35 degrees centigrade, the high-touch surfaces, which are indoors, will still be transmitting infections. So all said and done, as the global models indicate, there is a potential that the caseloads will decrease. But then again, all the modeling studies have vast amount of uncertainties associated with them. And overall, we will have to be very vigilant and keep deploying our public health interventions to ensure that the transmission is limited.
Okay, Dr. Kumar, your views on that, as Dr. Pranab is pointing out that the cases might come down, but correlation does not necessarily mean that it has it depends on the cause and effect scenario as well. Causability is definitely not equivalent to correlation here.
I fully agree with him because I think that was a disclaimer I said in the beginning. This whole correlation is the data, the way it looks like in different countries, different cities. So it shows some numbers. But if you see the paper that we wrote and the work that we have done, very clearly we have written that there is absolutely no second thought that you have to have social distancing and maintaining the hygiene. That's the basic minimum thing. The only thing what we are saying is that places like ours, people should not become complacent because we have high temperature and start doing open door, the way we do Mela and Mandis and all of that. That open door also is not going to be beneficial because the temperature is high. Because you are touching a lot of surfaces and a lot of people are moving around, you are contacting them, and I know this is something which is not easily controlled in our country. So therefore, while we will get some benefit of temperature, we should not forget about the social mingling aspect, which is not going to it's not going to be a normal situation anymore, which we used to do in all our mandis, bazaars, melas, everything.
Okay, Mr. Rath, so as Dr. Chatterjee pointed out, there is a huge difference between the normal influenza virus and the one which we are countering right now, that is COVID-19, and even the previous cases which you cited, the MERS and SARS, viral attacks as well. So the data might give you some reference, but you will have to look out the box. All those who are doing research will have to think out of the box here to try and find what is the missing link.
Yeah, exactly. That's why I'm trying to see it.
Not depend on the simple aspect of correlation between the virus and the rising temperatures. What beyond that? Then what's the advocacy here, both from ICMR and you specifically?
Okay, thank you. So as Dr. Rakesh has pointed out, it's vital that we still adhere to the proper public health interventions. We maintain social distancing as much as is feasible. We keep on testing and isolating and treating individuals, especially those who are at high risk. And we ensure hand hygiene, we ensure high-touch surface hygiene, and all sorts of transmission barriers to prevent the spread of infections. The other thing that I want to also raise at this point is that if indeed temperatures going up implies that the caseloads are going to go down, that means we should say beyond October, when the temperatures start going down again, we should start preparing for a second peak, which is also a natural corollary of the temperature-dependent hypothesis. Again, irrespective of whether that is true or not, as public health physicians, as individuals, as citizens of a nation which is mounting an enormous response against COVID-19, we have to stay aware of how to protect ourselves, especially those who have comorbidities, especially those who are elderly above 50 or 60 years of age, especially those who have survived TB, diabetes, cancer, hypertension, heart disease, because we know that these are the higher risk individuals. So we must look at it as a holistic situation rather than as a single point agenda. So participation from physicians and healthcare workers, from the general population, from the policymakers, from the government, from the hospitals and other institutions, from private sector players, and most importantly, as Professor Rakesh pointed out, from people who are in the markets, who are going and having multiple contacts with a lot of people every day. For all those people, we have to remain vigilant, and we cannot let the complacency of thinking that our higher temperatures and higher humidity is going to protect us become a barrier in the fight against COVID-19 in India.
Okay.
The understanding is that at lower temperatures and drier air, the droplets carrying the virus is more stable. As the temperature increases, as the absolute humidity, which is the amount of water vapor in the air, increases, these droplets become less stable, and hence the transmission is lower. But indoor, particularly if you are living in a cool room, these assumptions will not be applicable. So we need to understand that even if the temperature is 35 degrees, 40 degrees outside, it may not translate into anything preventing indoor transmission, intrafamilial transmission. And as the WHO and China joint report has pointed out, a significant number of cases, a secondary attack rate, which is almost 1 in 3, can be from intrafamilial transmission.
Okay, so that is something which we need to be very wary of out there. Dr. Rakesh, concluding comments from you on the overall aspect. Obviously, these kind of studies do give us a lot of understanding into which way the virus behaves or how it, reacts to rising temperatures or humidity as well. But as all of you are pointing out, and specifically Dr. Chatterjee, that we cannot let complacency set in.
I fully agree with him and everyone here that this is completely new thing that we are dealing with, right? And when we're dealing with there is something called precautionary approach, that you need to be more precautious in during this situation where you have no idea Some of the other SARS and MERS case, probably we have enough data and some points to prove. Just before we started the study, I have been telling my colleague, I am a person who works in air pollution quite a bit, and I understand aerosol a lot. When we were saying that only those who are affected must be using mask, and I was saying that everybody should use mask, because it is, even if it's there in air for 15 minutes, 20 minutes, 1 hour, it's going to infect people. So I think the first step right now, which has happened, which is very good, that everyone, whether you are indoor, outdoor, must wear a mask. That would actually help all of us a lot. And temperature and humidity related thing that we are saying, we are in a country probably is helping to some extent, but it's not something which we can bank upon. That's not the way to look at the problem.
Okay, so there it is. Thank you so much, Dr. Kumar, Ms. Rath, and Dr. Chatterjee as well for your views on this particular topic here. As our panelists and experts are pointing out, well, yes, there have been some studies which have been conducted, and some are being done right now to try and understand the correlation between the COVID-19 virus and rising temperatures or high humidity as well. Now, there might be some correlation based on certain factors, but as our experts are pointing out, we cannot let complacency set in. Rising temperatures, that correlation between temperatures and the COVID-19 virus might not clearly mean the cause and effect theory as well. So we will have to be very careful. We will have to adhere to all social distancing norms, practice personal hygiene very rigorously, and also make sure that we follow all other guidelines which come in from the health workers, Ministry of Health, or respective governments also. So stay safe, stay healthy, keep watching Rajya Sabha television. We'll come back again with a different topic. Thank you.